Thank you so much for coming. Are all of you volunteers working at the festival today? Is that what? Yeah, fantastic. And students? Yes, amazing. In Mississauga or everywhere? Yes, everywhere. High school, college, university, like all that. College? Amazing, amazing. Okay, cool. So, thank you so much for coming in today. I'm really happy to see all of you, and we're super excited on behalf of Trillium Health Partners to be here as part of this wellness festival. I think we all feel on behalf of the hospital, this is what we want to do for our community, is to really talk about how we can all be healthier in our wellness journeys. So my name is Dr. Sameena Uddin. I'm a thoracic surgeon. I work at Trillium Health Partners, and I'm going to talk about cancer prevention and cancer screening. And so because you're all students, and I'm happy to be a little bit informal also, I'm going to take questions at the end, but we'll roll through a couple of basic topics around cancer prevention and cancer screening. So as a thoracic surgeon, primarily what I do is treat cancers surgically. And so that usually involves a lot of lung cancer, esophageal cancer, but most cancers can go to the lungs. So it really includes a lot of other disease sites as well. So that's a little bit about what I do. And I'm really happy to be here along with my colleagues and other physicians who are going to do some of the other presentations to talk about really whole healthcare. Okay, so I hope all of you are doing well again. We all know people that are affected by cancer. We all know friends, family members, unfortunately, that have been impacted by this really terrifying disease. And often when people come to see me, they're in their most vulnerable moments, receiving this terrifying, life-impacting diagnosis. And so we all try and help people through their cancer journeys, from prevention, screening, diagnosis, treatment, survivorship, sometimes palliative care, end of life. But today I want to focus on the front end of all of that, which is really what can we do to prevent cancer? And what programs do we have that can find cancer early before you even know that it's there? So we're going to talk about prevention and screening. So probably, does anybody know how many cancers, like in 10 people, how many cancers could be prevented? Take a guess. No? A lot? So 4 in 10 cancers can actually be prevented. There are risk factors that we can impact and change to at least reduce the risk of cancer in 4 out of 10 people. It's quite amazing. So let's get into it. I'm going to talk a little bit about some research and some studies and some numbers, and then also some basics. The good news is that you already know most of the information, and the talk is titled The ABCs of Cancer Prevention because it's really just that simple. So I'm going to start by talking about one study. It's called the COMPARE study. So it's a Canadian study that was published in 2019 and looked at patients diagnosed with cancer in about 2015 to 2019. The COMPARE study stands for the Canadian Attributable Population Risk of Cancer. And so it looked at over 30, here's my kids over here and my husband, thank you for the moral support. So excited to be here, amazing. So this study looked at over 30 different types of cancer and analyzed and studied about 20 risk factors that we could modify to reduce the risk of cancer. And what it did actually was to show that those risk factors could reduce the impact of cancer by about 70,000 cases in 2015. 70,000 patients could have had a reduced risk of cancer or a diagnosis of cancer gone by impacting these 20 risk factors. And there was also a predictive part to this study too that said that by 2042, if we were to make better choices and impact certain health policies, we could reduce the diagnoses of cancer by 100,000. It's not a small number. So there's some really important things that we can do to lower this risk. Okay, so let's get into the details. So 4 in 10 cancers can be prevented through healthy living choices and policies that can protect the health of all of us. So we're going to go through some of the risk factors. And as I said, you already know all of the answers. Number one most important thing is to live smoke-free. And so the single most important thing you can do for your health is to not smoke and to avoid all smoke from all sources. And so we know that smoking is the direct cause for about 18% of all cancer disease. Thank you. It's them. It's okay. I'll have to talk over them. And smoking actually is the cause for about 30,000 cancer deaths, not small, each year. And so living smoke-free is directly related to not getting cancer and prolonging your life. Smoking is related to obviously lung cancer, but literally every other type of cancer as well. So being a lung cancer surgeon, I often have a conversation with all of my patients around smoking cessation. And usually that's often through harm reduction models. I'm happy if you cut back. I'm happy if you work towards cutting back with the goal of eventually quitting. And usually my speech to most people is smoking is the single most important thing you can do to impact your life. And perhaps not for all of you, because you're also young, but for all of my older patients, and perhaps for all of your older family members, I say quitting smoking is super important for the last 10 years of your life, when you really want to be independent and functional, and you really want to not have dementia, have had a stroke, heart attacks, can't walk because the blood vessels in your legs are blocked. So many things that smoking does impact not just your cancer risk, but overall health. And so quitting smoking is directly related to improving your overall survival, reducing your cancer risk, and overall leading a more independent, functional life, especially in those last 10 years when we're going to be alive into our 80s, but you want to be living well. Okay, and just a last point, living smoke-free means eliminating all forms of smoke. So that is secondhand smoke, hookahs, bidis, all sources, environmental. We have to think about all sources of smoke and try and protect ourselves. There's limited information on cannabis and weed use, but usually my party line is eat it, don't smoke it. This I say to all of the younger people that come and see me, because even the smoke that you inhale definitely has an impact on your lungs. And so eat it, don't smoke it. Okay. The second big point for cancer prevention is eating well. And so 6 in 10 adults in Canada have an unhealthy diet. It's quite a bit. And I think we all can do better in terms of thinking about what we eat, how we eat, and eating more healthy. So what is unhealthy? Unhealthy really is defined as having less than 4 servings of fruits and vegetables in a day, eating red meat, and eating processed meat. And so that's the basic. In general, eating more fruits and vegetables, as you can see here, is definitely better for your health. And so reducing the amount of red meat to less than 3 3-ounce servings in a week, it would be considered healthy, and just eliminating all processed meats. And processed meats means like sausages, hot dogs, like all this stuff that has additional chemicals in it. All processed meat has a risk tied in with cancers, specifically colorectal, other GI cancers, esophagus, stomach, etc. So reducing all red meat and processed meats is really important. We hear a lot about sugar. And so lots of people come to me with their cancer diagnoses and say, okay, well, I eliminated all sugar from my diet, because doesn't cancer eat sugar? And so there's some myths and there's some truths in this. The bottom line really is that all of our cells in our body reduce whatever you eat to sugar and glucose. There's no way to eliminate sugar from how it's processed in our bodies. And so it's all going to turn into sugar. But the key thing is to limit the amount that you add into your diet. So once again, avoiding processed foods, avoiding things that have hidden sugars in them, like sugary drinks, fruit-flavored yogurts, 100% fruit juice. All of these add up in terms of your total sugar intake. And so the recommendation is, in fact, to have only 5 to 10% of your total calories in a day from sugar. And so you just have to read the nutrition labels. So if you're eating like 2,000 calories a day, 5% works out to about 24 grams or like 6 sugar cubes. It's really not a lot. So minimizing processed sugars, super important. Other things to think about, total salt intake, but overall, eating a diet that's weighted in fruits and vegetables is definitely the most healthy for you, for cancer risk, and as we're probably going to hear, for other heart health as well. Okay. Third, number 3, having a healthy body weight. So we know that, for numbers, besides living smoke-free, excess body weight is going to be the second leading preventable cause of cancer in the future. And so by 2042, this is going to be the second preventable cause of cancer. So more than 50% of Canadians have an excess body weight. Weight is really complex. It's really hard. Everybody has their personal best. There's lots of normals for all of us. And so really what it comes down to is finding what works for you and what is your steady personal best sort of weight, and trying to be healthy in your food choices and activity as well, and balancing both. So thinking about weight is very important. Number 4, so move more, sit less. It was pretty shocking to me to read that we spend, as Canadians, about 10 hours a day in a sedentary setting, meaning that you're just kind of sitting around, not moving much. And for those of us that work at desks, that can be up to 60% of our waking time. So the other thing I say to my patients all the time is you got to move every day, and sitting is the new smoking. So you really just have to move. And it's really important for maintaining muscle mass, heart function, and maintaining weight as well. So moving every day doesn't have to be complicated, doesn't have to be a gym, doesn't have to be expensive. You just gotta get up, get out of your desk when you're all studying at your computers all the time, and just stretch, take a little walk, do a couple squats, whatever you wanna do. But just keep it simple and build it into your daily routines. And then a couple of simple things. So be sun safe. There these days is no amount of safe sun. There's no tan that is good for you. Maybe some creams, I suppose, but that's about it. There's associations with indoor tanning, definitely with the sun. So to be sun safe is to prevent skin cancer, of course, the most. The other thing is alcohol. So just for some data points, the new guidelines have come up around alcohol consumption, and it's basically quite low and much lower than what they used to be and what we probably drink per week. And so 3.5 drinks a day increases your risk of getting colorectal and breast cancer by 1.5 times. And it doubles or triples your risk of developing head and neck cancers like the mouth, throat, esophagus. So 3.5 drinks a day. Probably, more happens on the weekend sometimes. And so being conscious of how much alcohol you're drinking is very important for also lowering your cancer risk. And so the lower your intake, the safer it is. So we ran through some of the lifestyle changes. There are also some basic recommendations around knowing your family history. There are definitely some cancers that run in families, and so being familiar with your family history can help you get into certain screening programs and increase your awareness and precautions for certain types of cancers. Getting vaccinated. There's some infections that are directly related to cancer. HPV, cervical cancer, directly related. So getting vaccinated against HPV can have a 100% reduction in getting cervical cancer. nobody should get cervical cancer these days. Everybody needs to get the vaccine. The other infection is hepatitis B that is related to liver cancers. So in work environments, we also have to be aware of, if you work outside, not today, be aware of the sun, any pesticides, asbestos, etc. in buildings, and know your environment as well. Certain places where we live with regards to pollution and radon can definitely also impact your cancer risk. Okay. So lastly, I wanted to talk a bit about cancer screening, and the UPNA Health information is actually really amazing, so feel free to stop by there as well. So cancer screening is a way of detecting cancers before you even know that you have them. So it's population-based testing that is directed towards certain populations, certain higher risk demographics, where you can be enrolled in a program to find cancers before you even know that they're there. And so Ontario has cancer screening programs for breast, colorectal, cervix, and lung cancer screening coming. And so getting screened for cancer is incredibly important. And certainly there'll be more information right at this table over here. And so Trillium Health Partners is part of a regional cancer program. So the Mississauga, Halton, Central West Regional Cancer Program. You can go to our Trillium Health Partners website and find all of this information under cancer services, and certainly more information right at this table right over here. I think it's very important to do what you can to stay healthy, and all of you being here today I think is a great testament to wellness and all of our health journeys. So think a little bit about making healthy choices. As I mentioned, it's really simple. You're probably all doing it already, and there's definite data that all of these things can reduce your risk of getting cancer. Okay? Thank you. All right. Any questions about anything? This is like lots of keen students right in front of me. All good? Yes. 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 I got it. So the question is, thank you, about the HPV vaccine, that you're supposed to get it around a certain age. So yes, that is true. I would probably suggest going to talk to your family doctor or a public health program to get the absolute recommendations on if you are still eligible. If you cannot get the vaccine, then you can be enrolled in the cervical screening program, which involves Pap tests, but there's a lot of good new ways of not having to get an internal exam, which is like the worst. So things are coming down the pipeline to make it easier for women's health, to make sure you do not have cervical cancer that don't involve getting like an internal exam. So things are going to change very quickly, very soon. Yes.
So for a lot of people who have said that they have been smoking for ages, is there a time when even if they start from today, for instance, that they would see a difference in their lifestyle, and would it make an impact, like similar to someone who has not smoked in their life ever?
Sorry, that's me. In case people didn't hear, is there ever a bad time to stop smoking? I'm going to say no. And so it takes about 10 to 15 years to reduce yourself to a baseline population risk. Milan's a respirologist, he's going to come talk afterwards. But about 10 to 15 years to reduce your risk of lung cancer back to a population risk. And so sometimes the damage is irreversible if you develop COPD or emphysema, some of the irreversible changes that can happen to your lungs. But there is definitely always a benefit in stopping smoking, and not just for cancer, but for your heart, for your blood vessels, everywhere in your body, to your brain, for dementia, everything. Yeah. Any other questions? Okay. Milan, Dr. Patel.
Many of my patients have lost their family doctors. How can they get referred for cancer screening?
Yeah, so you can refer yourself for cancer screening in many instances. Probably our table over here has more information. But if you go to our website at THP Cancer Services, it'll tell you about how you can get checked. The government also tends to send you letters and notifications to let you know that you can be enrolled in cervical cancer screening, breast cancer screening, colorectal cancer screening. So if you are linked in with an OHIP number, you're going to get notified, but you can also enroll yourself in cancer screening programs if you are eligible. Yes? Okay. Thank you.